Okay, so we're about to talk about a number that you have probably known your entire life, a number you just accept. But what if that normal we all learned about is actually a medical myth? In this explainer, we're going to figure out what your real normal temperature is.
Yep, there it is, 98.6 degrees Fahrenheit. That's 37 degrees Celsius for most of the world. For over a century and a half, this has been the number. It's supposed to be the universal sign that your body is running perfectly. But is it really?
So, what if I told you that this single number is kind of more of a guideline or even a myth than a hard medical fact? And what if your personal normal is actually something totally different? All right, let's dive right in by busting this major myth. The whole idea of pinning our health to one single temperature is just, well, it's an outdated way of thinking. So let's look at what the science actually tells us today. Here's the most important takeaway. Your body isn't trying to hit one perfect number on a scoreboard. Health isn't a single point on a thermometer. It's a dynamic, healthy range of temperatures. So what is the new normal? Well, for a healthy adult, your temperature can swing anywhere between 97 and 99 degrees Fahrenheit and be perfectly, completely fine. So if you've ever taken your temperature and seen a 97.8 and started to worry, don't. You're almost certainly right in your healthy zone. But normal isn't just a range, it's also deeply personal. I mean, my normal is different from your normal. And understanding what makes your temperature go up and down is the key to knowing when something might actually be off. You know, your temperature is constantly on the move. It's usually at its lowest right when you wake up, and then it peaks in the late afternoon. Age is a huge factor. Kids tend to run hotter, while older adults often run a bit cooler. Heck, even just drinking a hot cup of coffee can temporarily mess with an oral reading. It's a truly dynamic system. Okay, so if 99 degrees can be totally normal for some people, then what what actually counts as a fever? This is where we really do need a clear, solid number that tells us, hey, your body might be fighting something. Here's the number you need to burn into your memory. Across the medical community, this is the consensus. A temperature of 100.4 degrees Fahrenheit, that's 38 Celsius, is the official line in the sand. Anything at or above that number is considered a fever for both kids and adults. Knowing the numbers is half the battle, but getting an accurate reading is just as important. You know the saying, garbage in, garbage out, right? So let's quickly walk through the right way to do it, because how you do it really, really matters. For adults and older kids, the oral method is the standard. First things first, you have to wait about 15 minutes after eating or drinking anything hot or cold. Otherwise, the reading will be way off. Then you want to place the tip way in the back, under your tongue. That's where you find these little heat pockets that give the most reliable reading. Close your lips, breathe through your nose, and just wait for that beep. It's that simple, but every step is crucial. Okay, for infants, the rectal method is considered the gold standard. Why? Because it measures the body's true core temperature, and that's what we want. Use a water-soluble lubricant, be very gentle, and never, ever force it. But probably the single most important step is this. As soon as you're done, clean it and label that thermometer for rectal use only. You really, really do not want to get this one mixed up. Now, the armpit method. It's easy, for sure, but it's also the least accurate. That's because you're measuring the temperature of the skin, not the inside of the body. To get the best reading you possibly can with this method, make sure that tip is right on bare skin, no clothing in the way, and then hold the arm snugly across the chest to trap as much heat as you can. So now that you know the how, let's talk about the what. There are a few different types of thermometers out there, and choosing the right one really just depends on who you're using it for and what the situation is. Looking at all the options here, you can see there's a clear trade-off happening between accuracy and just how easy it is to use. For a baby, nothing, and I mean nothing, beats the accuracy of a rectal thermometer. For adults, oral is your reliable go-to. Those forehead and ear thermometers are super fast, which is great for a quick check, but you gotta know that their accuracy can sometimes be a little hit or miss. And the armpit method? Yeah, probably best to save that one for when it's your only option. So, which one should you actually go out and buy? Well, for most families, a good quality digital stick thermometer is going to be your most versatile and reliable choice. If you've got young kids, the speed of a forehead or an ear thermometer can be an absolute lifesaver. But just remember that how you use them makes a huge difference in the reading you get. And now for a very, very important safety announcement. If you still have one of those old school glass thermometers with the silver stuff inside, please find out how to get rid of it safely. That's mercury, and it is toxic. They aren't recommended anymore for exactly that reason. If they break, it's a real health hazard. Just go digital. It's safer for everyone.
So we're going to end with this question for you. Now that you know that normal is a range and not a single number, the best way to know when you're actually getting sick is to know your own baseline when you're healthy. So why not try it? Take your temperature a few times over the next couple of days while you're feeling good. Find out what your personal normal is. It's honestly one of the simplest, most empowering things you can do for your own health. Thanks for watching.